Thank you, Rashanik. And if you weren't aware, Rashanik is not only trying to commercialize the technology that she's been working on as part of her PhD work here at UNC Charlotte, but also in the process of finishing her PhD all at the same time. So very impressive. And if you're looking to connect with her or the other two presenters, please feel free to connect during the Q&A session. And if what you've heard today and you're interested in participating in the Ventureprise Launch NSF-I Core program, you can visit us at entrepreneurship.uncc.edu and fill out an application. And as I mentioned earlier, our next cohort starts in May and will take place from May until about the second week of July. So it's a great opportunity. Usually our summer cohorts are the largest, so please consider applying if you haven't participated yet. So with that, I'm going to turn it over to our next presenters. We're excited to hear from 6 companies that were selected into the Ventureprise Launch Summer Accelerator. These 6 companies represent both community-based startups as well as university technology teams. So we have 3 university technology teams and 3 community startups that will be participating with us this summer. Each of the teams selected will receive $2,000 in funding, as well as a entrepreneur residence that will work with them over the course of the 3-month accelerator program. And this is our 3rd year of the program. So if you join us for the Q&A session to follow, you'll also hear from one of our past participants as they discuss how the program worked for them, where they are now, and try to help some of the companies that you've heard from today. And please, if you hear something that these companies are working on and you can offer some help, please try to connect in with them. So with that, I'm going to turn it over to our next presenter, which is Penny Campbell of Seniors in Transition.
Hi, everyone. My name is Penny Campbell, and I am the founder of Seniors in Transition, or S.I.T. What is Seniors in Transition? I'm glad that you asked. Seniors in Transition is a mobile app that's designed to reduce the phone time for nurses and family members of patients in the memory care units of long-term care facilities by providing them with a quick update on the patient's mental and physical health. It will also provide users with information about prescriptions, such as the name, the purpose, and common side effects. So what is the problem that we're trying to solve? During my customer discovery, I found that there were 2 main issues or complaints, which were communication and medicine. So with communication, there is a communication gap between skilled caregivers, such as nurses, and non-skilled caregivers, such as family members or friends of the patients in the long-term care facilities. So the skilled caregivers or the nurses said that they found that they would love to give information about the family member's loved one, but they just didn't have the time because they're understaffed. And the family members' complaints were that when they wanted information about their loved one, either they were put on hold, they had to call and leave a message, or depending on the size of the long-term care facility, they got the runaround for the nurses unit. The second problem was medicine. Many of the patients suffered from illnesses that were caused to be side effects from the different types of medicine that they were prescribed. So they felt that a little more literacy around the medicine would be helpful. So how will Seniors in Transition aid with this solution? For communication, we will have an in-app chat feature, which will have a smiley face feature. So if grandmother is doing well, the nurse would just quickly click on the smiley face. And so the family member will know, okay, grandma's doing well, and we won't have to call, which reduces the call time for both parties. But if she's not feeling well or having a bad day, they can also click on that smiley face as well and type in or speak into the text box for the chat feature to let them know. And then that way they can decide, do I need to just text you back, or does this require a phone call? And for medicine, it was suggested that to take a photograph of each type of pill that the patient is prescribed. The app would store the photograph and give information, as I stated before, such as the name of the pill, the color, because some people identify their pills by color, the purpose of the pill, and the 3 most common side effects. So what are my current needs and what will I be concentrating on this summer? First will be becoming HIPAA compliant, then to modify my MVP to meet the customer's needs, then work with partnership or establish a partnership and obtain customers, which in turn would give us a pilot study so I could see which things are effective, which things are non-effective, and gather some metrics. Thank you for your time, and I look forward to working with you this summer.
Hello, everyone. My name is Ash. I'm a software engineer. I specialize in full stack mobile and web app development. Today, I'm presenting to you Bite Savvy, a mission to fight food waste and to help local restaurants and bakeries. Bite Savvy is an online surplus food marketplace that connects restaurants and bakeries with unsold food with consumers looking to rescue them at steep discounts. We all know food waste is a problem, but when we look at the numbers, reveal a story that it's a much bigger and shocking problem. One third of all food produced in the US is wasted, and this estimates to $218 billion, and 40% of all this food waste comes directly from retailers like restaurants, bakeries, and grocery stores. On the other hand, the same retailers, these restaurants and bakeries have been struggling over the last year because of the COVID pandemic. Revenue continues to be down, and the cost of acquiring new customers is up. Food delivery and online ordering apps charge up to 40% in fees and commissions per order. So our solution to this problem is a surplus food marketplace that connects these retailers with delicious unsold food with hungry app users looking to rescue them at discounts. So perfectly good food, instead of being tossed out, can be rerouted to consumers that'll rescue them at discounts. So how the product works is retailers list surplus food for sale on the Bite Savvy app. App users in the area get notified and they can browse through deals on the app and place an order. And the user goes to the store at the specified pickup time and picks up a mystery bag. A mystery bag is just, so if there's a bakery posting a deal, so you don't know what you're getting, so it adds to the fun element, surprise and fun, and it turns it into a food adventure. Target market. So on one side, we have retailers with unsold surplus food, bakeries that can predict how much to bake per day, so baked goods, and restaurants with longer menus and prepared food. And on the buyer side, we have young professionals and college students. So how is this helping both sides? Sellers use our platform and get paid to capture new customers. For buyers, it's a food adventure with great discounts, and all this while helping the planet. So the next steps for Bite Savvy. So I recently went through the Ventureprise Idea Launch Program, and in Ventureprise 2.0, this is what I'm looking to do. I want to run a pilot program with 10 restaurants in a 5-mile radius and about 250 users. Maybe start this with a Facebook app group or a minimal MVP, and use these learnings to improve the process and technology and improve upon the MVP, and run a marketing campaign to acquire at least 30 restaurant partners and 750 app users pre-launch. And we're looking to launch this by the end of August this year. And thank you very much. If you or anyone you know is looking to join the team and you love the idea, please reach out to me. Here's my email on the screen.
Hey everyone, my name is Adonis Abdullah. I am a graduating senior here at UNC Charlotte and also a rising master student, master's in data science and business analytics. And I am also the co-founder and CEO of Hot Route Analytics, a sports analytics firm. All right, so after completing customer discovery interviews with almost 70 executives, coaches, and players from the NBA, NCAA, MLB, and high school ranks, we found that this is kind of the sports business model. And similar to any industry, it all begins with big data. And really what coaches are wanting to do with this big data is to use this information to help them devise the perfect game plan or strategy to help them win more games, to ultimately help them earn more revenue. And this is often implemented by just the big schools. If you shift over to the right, this graph, most schools can't afford to obtain this data. And so this modern business plan doesn't work for them. The large D1s can spend 9 million a year, but everyone else can spend pennies comparatively. And so this problem is that big data and this business model is unaffordable and unobtainable to most colleges and semi-professional teams. And it's so expensive because the current sports analytics companies are using these third-party resources because they want to give coaches, the entire Pandora's box at the speed of light. And coaches really just want the information they need when they need it so they can devise the game plans that they for the next game coming up. And ultimately, this is causing teams to disband across the country as a result of not earning enough revenue. And so our solution to this is offering predictive analytics at a low cost. We want to offer predictive analytics because it cuts out all that middle information that coaches really don't care too much about from what we've learned during our discovery process. And we're just giving them those actionable results from the data. And currently we're doing this as with a mobile app, with our Next Pitch mobile app, which is designed to predict the next pitch in real time, using the momentum of the game to predict the pitch before it comes. And we're able to do this at a low price because we're not focusing on giving coaches everything that's in this treasure chest of data. And we're not trying to do it the quickest. It's very contextually aware. We want to just provide them with what they want right before their game so then they can strategize for it. And that prevents us from having to spend money on expensive servers or cloud computing or getting cameras set up in arenas. We can keep our costs really low and then we pass that on to our customers. So our market, it is about a $2.7 billion market. This is the total spend of all colleges and universities in America. And the market that we're focusing on is about $1.9 billion. This past year, we've had some really cool traction. We've been able to work with colleges ranging from North Carolina down to Texas. And we've done 4 pilot programs so far with our app, although we had interest from around 80 teams within our 6-week marketing campaign that we ran. And so looking forward, we really want to capture more of this market because it is so expansive. And so looking ahead into this summer, we really do want to gain customer feedback from our current customers. We want to define a repeatable sales strategy for our app, conduct 30 to 40 customer discovery interviews, run some pilot partnerships with other universities to see how we can go beyond baseball. And finally, we want to add 1 to 2 advisory board members. And we want to do all of these things, again, to just really capture more of that market and just continue to expanding what we're doing. And so thank you all for listening.
Right, okay, great, everyone. I'm Victor Chen. I'm an associate professor of management at the Bell College of Business and also affiliate faculty in org science and the School of Data Science at UNC Charlotte. I'm the founder of a new product called AMI, standing for Expertise Management and Integration for Enterprise. I'm also the founder of GoPeaks Initiative. So the problem I'm trying to solve through my venture is based on the observation that current business system is not working well for people and society. It is not because the managers are not responsible or not ethical, not all that. It's because we don't have many good tools for decision makers to be able to foresee the consequences that decisions are making on different people and stakeholders and society. And the reason for that is not because nobody's doing good research, and it's the opposite. We have tons of research. The research and the knowledge is buried in fragmented and inaccessible sources. And it's not accumulating into good tools So my hypothesis is, what if we can automate the reading and the synthesis of all the research insights into instant tools for decision making? So over the years, I and my colleagues in business, in data science, in computer science, have developed several prototypes to do this integration automatically. We've built natural language processing models, we've built user interfaces, and we've built graphic simulations for knowledge graphs. And eventually we want to synthesize all those advancements into a shared brain. So the brain is like a system that can detect and integrates causal insights from fragmented local knowledge systems, both academic research and also the businesses themselves, into a unified causal knowledge graph to inform causal modeling for explainable AI and machine learning, and eventually to prescribe responsible interventions for the business decision makers. With that hypothesis, we created a team early this year called AMI, standing for Expertise Management and Integration for Enterprise. And we participated in the National I-Corp, National Science Foundation I-Corp program. In this program, we interviewed 112 major potential customers and partners representing almost all the top leaders in the enterprise performance space, as well as the consultants, the influencers, and end users. We have confirmed our hypothesis that most decision makers in enterprise management desire to have causal insights and desire to have such insights to be integrated graphically and intuitively into decision tools. So to end my presentation with the slogan of my initiatives, that is, we strive for the whole truth in a fragmented world by building a shared brain for people and society.
Hi, I'm Kim Herklerode, and I'm the founder of No Mess SPF. We've got your back. But first, a little bit about me. I'm originally from Pennsylvania, and I have been in the consumer packaged goods industry for my career in marketing all the way to strategy. I grew up playing outside in outdoor sports, and the dermatologist became an annual appointment. I've had 20 plus biopsies since the age of 9. And it wasn't until my father, who's pictured here, developed melanoma that I started to dig into the problem and ultimately have the goal of making a difference and advocating for future prevention for hopefully my nephew, who's pictured here. The problem is ineffective sunscreen application practices that are time-consuming, inconvenient, and inconsistent. Applying sunscreen takes time. It's really easy to miss a spot. And there's, opportunity for people to still enjoy being outside and not have to hide from it, like the picture in the middle. I was paired with Brian Deniston at the SPTDC last January, and he helped me take my idea and run with it. And ultimately, I was able to lean on a patent holding engineer, a well-established financial advisor, and countless others in the Charlotte ecosystem who have dedicated their time, resources, and support to help me with this venture. And now the solution, No Mess SPF. It's an automatic sunscreen applicator covering exposed areas on you and your family's bodies to avoid sunburn in under 5 seconds. This is a future rendering, but the intent is for it to be at outdoor venues as shown, and I've already received some positive feedback from potential consumers. So during the customer discovery, I found a couple of key things. I was able to get over 300 surveys from consumers. And in addition to in-person tests with my minimum viable product that my engineer developed last year. There were a few key things that I found during customer discovery. One being females with kids under 8 were most interested in the solution because it had an easier component and something more simple for them to be able to protect their family. In addition to single female adults, because they don't have to have someone help them get their back. And one of the upgrades that they requested was that it be height adjustable, which I've been able to do with my 2021 minimum viable product shown here on the right, which also adds an improved convenience. The top 3 places that consumers expected to find a solution like this were pools, water parks, and public outdoor recreation. Therefore, my concentration during the Accelerator will be to get in contact with these venues starting in North and South Carolina. My ask is help broadening my pilot tests with potential clients via warm introductions, and ultimately collaborate on a final design and have partnerships by the beginning of next year in order to make a positive impact. Thank you for listening, and remember, we've got your back.
Hello, everyone. We are Accelerator Technologies, and we're looking forward to stepping into a new era of digital healthcare. So I am Pedro Regalado, the founder and CEO of Accelerator Technologies, and we also have our technical advisors, Dr. Chen Chen and Dr. Tao Han, and our CFO, Scott Christensen. So how did we get here? We first started by researching different mixed reality technologies and solutions. We combined this with different edge computing researchers to see how we can be as low cost as possible, as well as different wireless systems, as that's where our society is heading as well. But we all know that an idea is only an idea until we put a step forward. So we applied to the NSF Ventureprise regional I-Course program, and we got accepted. Through this program, we were able to do over 30 plus interviews, interviewing different people in healthcare, manufacturing, sports, and education sectors to see where mixed reality could best put its foot forward. We were also able to do a business model canvas focusing on value propositions as well as customer segments to see what Accelerator could offer and who our audience was. Then after this program, we took a step forward and also applied to NSF Ventureprise National I-Course program. And through a rigorous interview process, we were also selected. And through this program, we were able to achieve over 100 plus interviews, now focusing specifically on healthcare sector to see where our niche was for our mixed reality solution. So some of the disadvantages in healthcare that we found through our interviews were that there were inefficient garment wearing tactics, such as especially in the ICU units, where nurses are going in, putting in their garments, taking care of patients, coming back out, taking their garments off and taking notes, and then going back in, etc. And it becomes a repetitive and inefficient task. We also found redundant note-taking where nurses are just charting all day long or just taking notes. And even if the desktop or computer is in the same room as the patient, sometimes the nurse is with their back to the patient, which decreases customer satisfaction and makes the patient feel unheard. Finally, there were burnouts. There's an average of 13 hours that nurses work per shift. And so this creates a lot of stress in their work when they're doing different things. So if you're still unconvinced, why Accelerator? We want to change the current digital healthcare. We want to remove the screen barrier. We don't want there to be phones, desktops, or computers anymore. We want everything to be right in front of your eyes. We focus on providing extreme safety by validating patient information with our facial recognition algorithms and doing verifying patient medication to see if it's correct. We save nurses a lot of redundancy in note keeping, and we improve customer satisfaction. We boost productivity and prevent different burnouts, as burnouts, we all know, can be a safety hazard as well when doing things and can cause more damage in the medical field. Finally, we allowed global collaboration so that with one button away, I can contact any other nurse or doctor in the world. And this is beneficial even post-pandemic. So what are our current needs today? We want to become OSHA compliant so that we can work with different clinics and hospitals. We want to partner for different key testing and parameters. We want to revise our cost structure of expenses so not only we can survive, but we can also thrive in our company. We want to shift from the prototype and minimum viable product to a full production phase. And we want to get key funding for marketing and sales. So through the Ventureprise Launch 2.0, we want to revise and update our cost structure, our key partners and resources, and get our revenue streams correct. We want to boost our marketing efforts. We want to take advantage of the mentorship, do pilot studies with different clinics and hospitals. And finally, we want to conduct surveys to make sure that not only the nurse is content, but also the patient as well. Thank you.